I realized that health is just, it's essential. It's the foundation of everything we do.
If your health is not good, your world is not good.
What's the difference between the African American body type and blood level and how sugar or salt may affect us?
So we say health is here and housing's here and education's here.
Right.
And then we wonder why we can't sort of get a system to work for everyone.
How do you change the system such that the next generation has such a better health outcome and really sees health justice, right?
How do you leverage education? How do you leverage urban planning? How do you leverage housing, the faith community?
I think it's very critical that we help to meet the needs of our communities everywhere.
When we think about health justice, I work at a large nonprofit that's working to make sure that every low-income family has an affordable and healthy home. A home is so essential, as we know, right? Heart, home, it's so important. And at the same time, if there's an affordable housing crisis in this country, right, where there's 20 million people paying more than 50% of their income towards their housing or don't have a home, they're homeless. And so when we think about health, like the health outcomes are just outsized negative effects if you don't have a healthy home. So we're really thinking about how to, change the system. How do we make sure that more people have access to an affordable home that's connected to real opportunity, a healthcare center, good schools, and transportation and jobs. And it is a system. For me, being a mom today, I'm thinking a lot about my personal connection to health, and I think about what's the future for my child, right? And what's the future for these kids I work with? And I was really blown away after Hurricane Katrina. We went down to New Orleans and we were working, and we committed to do 10,000 affordable, healthy homes. And one of my passions, thank you. It's cool, really cool. And, it's huge, it's huge. What I was so passionate about is knowing that like the kids in the area we work today, their life expectancy is about 55 years of age, and it's primarily communities of color, it's low-income families, and then white middle class, 2 blocks away, the average life expectancy is about 80 years old.
Wow.
So these kids are getting robbed of 25 years of their potential, of their dreams. So you think about our own kids, right? So how do we think about that? So I just want to be up to making sure that everybody has a safe and affordable home and making sure that's really connected, because that affects health, and it's all about health justice.
Absolutely, yeah.
And if you think about it, how place matters, zip codes matter.
Exactly.
And that's really the inequity, and it shouldn't be. And so I think that's where there's the opportunity where, each of us, as we are leading, not only just in our homes, but in our own organizations, how we can all look to leveraging our strengths to help to work toward health justice. And so how do you leverage education? How do you leverage urban planning? How do you leverage housing, the faith community? Bringing all those together to work toward making a change and correcting that infrastructure so we don't have that disparity.
Absolutely.
And I think acknowledging the disparity, right?
Right.
That's the first thing.
It's important to
Big.
me. So as someone who works on issues of social justice and civil rights, I think we sometimes really pull apart the issues, right? So we say health is here and housing's here and education's here.
Right.
And then we wonder why we can't sort of get a system to work for everyone. And I think my experience is that they have to be connected, right? And we have to acknowledge that the systems don't all work in the same way for every single person, which you just talked about. So when I think about being someone who's biracial and understanding sort of the importance of acknowledging all parts of ourselves, right? On one side of my family, there's diabetes, and a strong history of diabetes, of having my uncle die of diabetes, and before he died, having his 2 legs amputated, right, on one side. And then on my mother's side, having heart condition, so being aware. So I'm passionate when I'm working with someone, which is usually around work, at work, like how we're also just acknowledging ourselves and taking a walk and, knowing what salt is sort of in my food, or drinking more water, or understanding the importance of CPR and how adversely impacted communities of color are when people don't know CPR. I mean, things like that makes a difference.
Yeah, I think
I'm sorry, go.
One of the things, I belong to Alpha Kappa Alpha sorority, and our international president, Dorothy Buchanan Wilson, we have a special program where we work in our communities through our chapters with the CPR and the training, making sure that there's educational awareness around the social justice issue, access to care, access to all of this information is very key. So I think it's very critical that we help to meet the needs of our communities everywhere.
And I think it's so important that we have to look at it holistically and not just holistically mind, body, spirit, but what's your environment? And so many times these young kids, we're just looking at how are they doing in school? Something's wrong in school, like maybe they're not catching things as quickly. And there's a lot of health issues around that as well. And you have a lot of, just like you said, a lot of our young kids, which is just devastating in this country, who are living below the poverty level, who may have a home, but it's not the best place for them to be. And we don't look at that a lot of times in terms of their health. And if we're addressing their health, we have to address everything around them.
What's so interesting, if you do that, I mean, not only does it make such a big impact on the health, but like health and like economic well-being and it's also really connected. So we are, for example, one of the things we're bringing together foster kids and moms who are homeless. And foster kids and homeless, those are two very expensive streams. What if you were able to take that money and instead make sure that there's a home, there's the right medical services, health services, so that you can reunite. And we're doing that. And it's about being able to do that and do it at a systems level up here, because that will make a huge difference, and you can do that on a scale. So those are, the things we're all working on, but bringing that together.